my name's Jade. I'm going to be working with you today. I'm going to be your therapist for
great. Nice
this appointment. Just right this way. Okay, so Daphne, we're going to start with just going through a bit of a health history before we get into anything, just to see where you're at. So you have a copy as well.
Okay.
I just want you to look over it as we go through the different categories.
Okay.
So what is your reason for seeking massage therapy today?
I found that I'm actually a marathon runner, and I find that 10K into my run, I get this burning sensation down my leg.
Okay.
And it makes it really hard to run.
Okay.
So I've just been finding it a little bit uncomfortable.
Okay. And did a healthcare practitioner refer you to this?
No.
And how would you describe your current overall health status?
It's really good.
It's really good?
Yeah.
And do you have a family physician? Or
No, I do not.
Okay. And are you currently under the care of a specialist physician or any other primary? Nope.
No.
And do you smoke cigarettes?
No, I don't.
And what is your current physical? I'm assuming it's probably very high.
Yeah, I do like to be active and run a lot.
Perfect. And are you currently experiencing or have you experienced any physical, sexual, emotional, or financial abuse?
No.
Okay. Is there anything we can do here that we can make you feel more comfortable with your time with us?
No.
Okay. And do you have any alternative or complementary medicines like vitamins or supplements or anything like that that you take?
No.
Okay. And what is your occupation? Or
I'm just a student.
Student? Okay.
So, yeah.
And some of the hobbies obviously are running.
Yeah.
Okay. All right, so now we're just going to go through different of these categories here. And I want you to let me know if you have any of these illnesses or diseases or if you have any family history.
Okay.
So I just want you to take a look at the cardiovascular section and let me know if there's anything throughout here that you...
Okay. No, I've never experienced any of these things, or neither has my family.
Okay. And what about musculoskeletal?
No.
All right, and respiratory?
No.
Anything in the nervous category?
No, not that I know of.
Okay. And anything in immune?
Nope.
All right. And no endocrine?
No.
No female or
no
infections,
gynecology.
blood or vision or hearing?
No.
Growth development?
Nope.
Cancer?
Nope.
And no others that are not listed?
No.
Okay, perfect. Okay, and have you experienced any injuries in the past or no? Any surgeries that we can note?
No.
Okay. And are you on any medications at all right now?
No.
Okay. And do you have any allergies or sensitivities that we should know about?
Nothing
Okay.
I know about.
Great. So now that I've looked over your health history, there isn't too much to be alarmed about or to note pertaining to your treatment. I'm just going to ask you a few questions in general. Just answer them as honestly or freely as you can.
Okay.
And that's just going to be our interview portion.
Yeah.
Okay. So, where do you run when you run?
I like to do a little bit of running everywhere.
Everywhere?
So sometimes I'm in trails, sometimes on the track, but mostly on the road.
Okay.
Just outside my house.
Right. Okay. So when you're on the road, do you normally run on one side of the road, or do you kind of alternate?
I think run just on the one side, actually.
And do you wear any orthotics to help you with your running or your feet?
No.
Okay.
I've never looked into that.
Well, it could actually help. There's an article by Dolsky and Petit that suggests that adding in orthotics as well as massage and other contemporary modalities can actually help improve the posture and the pain.
Oh, really?
Yeah, so
That's
if you're
really
interested, I can refer you to a podiatrist and get that looked at.
Okay, awesome.
Awesome.
I would like that.
Okay, and what is your sleeping posture like?
Right now I'm sleeping on the right side.
Okay.
Usually, yeah.
And your occupation, you said, is a student.
Yes.
Right. And do you have any hobbies besides running?
I just like being outdoors, doing anything outside.
Okay,
really.
very active. Right. And how does this pain affect your daily living?
I find that it's stopping me from running as long as I would like to.
Okay.
Right when I'm like getting up from sitting, sometimes I'll get a little bit of an ache.
Okay.
If I'm sitting too long, I definitely get an ache. Yeah.
Okay, gotcha. Okay, and what footwear do you use when you run?
I use just my one pair of running shoes I've had for about a year.
Okay. Gotcha. And your activity level, you'd say, is very
quite
high.
high.
Okay. Yeah. Okay, so I'm just going to ask you a few questions pertaining to the pain that you've been experiencing. On a scale of 1 to 10, how would you describe your pain, 1 being the least, 10 being the most pain you've ever felt?
Probably a 5.
A 5, okay.
A 5 out of 10, yeah.
And how long have you been experiencing this pain?
On and off for about 5 months now.
5 months, okay.
Mm-hmm.
And does anything kind of help relieve the pain for you at all?
Actually, you know what? I noticed that I didn't feel as much pain after the hot tub.
The hot tub,
Mm-hmm.
okay. So some heat helps relieve.
Yeah.
Okay, and do you know what caused the pain?
I don't know exactly when
Okay.
it started, but I think it's from running.
Okay. And what makes the pain worse?
Well, it's usually while I'm running
right.
around, when I hit around the 10K mark. And
Okay.
usually before I'd be able to run past that with no problem.
Okay.
And now it's starting to bug me a little bit more.
And how frequently throughout the day do you feel the pain?
It's not all the time,
Okay.
but definitely when I run.
Okay. And when it comes on, how long does the pain last usually?
Probably for an hour,
Okay.
up to an hour.
And do you take anything to help alleviate the pain?
No.
No, okay. And can you describe the quality of pain? Is it sharp, shooting, burning, dull?
It throbs a little.
Okay.
It's a little dull, quite aching.
Okay.
And if I hit it like while I'm running on the wrong angle or something like that, it sometimes sends like a little bit of a sharp pain.
Okay.
Mm-hmm.
And is there anything else in general that you can tell me about this type of pain?
No, I think we covered all the bases.
Okay. Perfect. So now I want to move through to our assessment portion for today. So I'm
Okay.
just going to go through a bit of consent with you just before we start.
Yeah.
So the purpose of our assessment is so that we can get a better indication of what's going on with your pain in here. There's no cautions or contraindications from any of your health history or anything that you've told me. So what we're going to be doing is mainly a few range of motion tests and some special tests just to see what's going on in the knee, primarily the knee and the leg region. This might provoke a little bit of pain. That's normal. If it's too much, though, we can always stop or modify. Most of the time, it's hard to modify, but we can always make adjustments. If there's anything that's outside of my scope, I will refer you to another healthcare provider. And if there's, and some of the ramifications of not getting the assessment is, of course, not knowing any further information about what might be causing the pain. Do you have any questions about the assessment portion?
No.
Okay. Do I have your consent to perform the assessment?
Yeah.
Great.
Okay.
Okay. So I'm going to start with blood pressure.
Mm-hmm.
Then I'm going to go through a bit of observation and gait analysis just to see where you're standing, what your posture looks like.
Okay.
Then we'll do some range of motion. It's a
Okay.
special test. And then we
Okay.
can get started with our treatment.
Sure.
Okay. So.
Now go.
So Daphne, this is just a lower extremity functional scale. I just want you to review it and answer either 0 to 4, 4 being no difficulty, 0 being lots.
Okay.
Just to see where your daily living is affected by your problems today.
Okay. Awesome.
I'm just going to grab the blood pressure cuff. And I want you to take out your left arm and place it on the table on top of the bed for me, please. Okay. Great. So your blood pressure is in the very good range actually. 119 over 75, which is awesome. So that isn't a problem for today's treatment at all.
Okay.
Okay. Great, and you can turn around and come back. Perfect. And I'm just going to be checking some differences, if there's any, on certain landmarks. So is that okay with you? Perfect. I'm just going to go from this side. I just want to check. Okay. So you definitely have some more muscle bulk on your left side, which is your affected side,
Yeah.
which makes sense.
Okay.
You also have a bit of what we call hyperlordosis, which is also pretty normal with what is going on.
Okay.
So just to get a better idea, I want to move through some range of motion as well.
Okay.
So now we're going to go into our range of motion portion of our assessment. I'm just going to have you start with laying on the table on your back.
Okay.
I'm just going to be putting your leg through some different motions.
Okay.
And just kind of gauging where it's at.
Sure.
So the first thing I want you to do is bring your knee up like this onto the table. Perfect. And I'm just going to measure if that's okay with you.
So you want to measure?
Yeah, just perfect.
Okay.
You can just extend out and then we'll go back in. So that's about 40 degrees. And now we're going to also do extension. So I'm just going to have you lay out. That's about 6 degrees. So now we're going to switch gears and I'm going to have you actually try to move your knee. Try to isolate it away from your hip and your ankle. It's kind of hard, but do your best you can.
Okay.
So perfect. I'm just going to start here. And I want you to do it for me. Okay, so there's a very, very slight degree, like 4 degrees, which is pretty average. There's not a lot of movement in there. And now we're going to go the opposite way. Okay, again, very limited, but that's really normal. So now I'm going to go through the same type of thing, but I'm going to be doing the action completely for you.
Okay.
Just relax and let me know if there's any pain or discomfort.
Sure.
Okay.
Yeah, it's just a little uncomfortable
Okay.
at my knee.
And still a bit uncomfortable. Okay, we have about the same ranges as the first time. I'm going to extend your leg out now. You can let me know if it's too painful. Okay, a little bit more. 1 degree more than last time, but any pain with that?
It's
a little bit? Okay. So I'm just going to be moving your knee.
Okay.
Just relax and let me know if it's too much. Okay, and a little bit, no pain, or a little bit?
No,
No?
Just feels a little weird, that's all.
Sure, that's a normal reaction. And any pain with that?
Pain, no.
Okay, so now we're going to switch gears again. The last actions that I'm going to be doing is I'm going to be applying pressure at a certain point. I want you to just meet that resistance and try to, like, don't let me move you.
Okay.
Okay. So I'm just going to start with your knee bent, and I'm just going to be applying pressure here and supporting here. So push into my hand. 1, 2, 3, 4, 5. 5, 4, 3, 2, 1. Great. 5 out of 5. I'm going to be applying pressure. Oops. You okay?
Yeah.
Down here. 1, 2, 3, 4, 5. 5, 4, 3, 2, 1. Perfect. 5 out of 5. No pain?
No pain.
Excellent. I'm going to be applying on this side. Try to meet my resistance here. 1, 2, 3, 4, 5. 5, 4, 3, 2, 1. Any pain?
No.
5 out of 5. And this side. 1, 2, 3, 4, 5, 5, 4, 3, 2, 1. Any pain?
No.
Perfect. Okay. So now we're going to be doing what we call a rule out, just to make sure that it's not the hip or possibly the foot that's kind of adding into the pain.
Okay.
So I'm actually going to get you to turn onto your stomach.
Okay.
Perfect. I'm just going to get you to bring your leg up. Okay. So what I want you to do is try to bring your leg out like this, and then I'm going to apply some overpressure. So whenever you're ready. Great. And overpressure, and that's okay? Great. So your internal rotation is 5.
Okay.
Perfect. And then I'm just going to apply a little bit of overpressure. And how does that feel?
It feels fine.
Okay, great. So we can rule out the hip as the issue. I just want you to scooch a little bit more. And I'm just going to check your feet, just to make sure your ankles aren't adding in. Okay. So I'm going to be asking you to take your foot kind of back like this. And perfect. I'm just going to apply a little bit of overpressure. Any pain or discomfort? Okay, relax. Now I'm going to be asking you to take your foot out, kind of out to the side. Perfect. And overpressure, any pain?
No.
Okay, great. So we can rule out that it is your ankle or your hip, and we can primarily focus on the knee now. Okay, so I want to move into some special tests. Okay, so we're just going to be testing your left leg just to make sure that ligaments are okay, because that seems to be kind of the area where you're feeling discomfort. So let me know if you have any pain at any point, and we'll stop.
Okay.
Okay. And are you feeling any pain with that at all?
No pain.
Okay. So that would be a negative for that test. I'm going to take you in through 2 more.
Okay.
The next one we're going to do is going to be called overs. So I'm going to have you actually lay on your side, but at the edge of the table here, if that's okay with you. Perfect. Great. And I'm right here, so you're supported. Just going to be taking your leg. Okay. So that would be a positive because your knee isn't dropping to the table, which lets us know that there's some type of IT band issue going on in there.
Okay.
So I'm just going to do one more test just to confirm that that is the issue.
Okay.
So I'm just going to have you lay onto the table onto your back. Okay, so the next one we're going to be doing is just nobles. It's the last one we're going to do just to confirm that it is an IT band issue.
Okay.
So I'm going to actually have your leg start like this. I'm going to apply pressure and I want you to slowly kind of extend it out.
Okay.
So we'll start like this.
Okay.
And I'm going to have you slowly start extending your leg out.
Okay. I feel a lot of pain.
A lot of pain?
Yeah.
Okay, we'll stop.
Yeah. Okay.
So that would be a positive as well.
Yeah.
So after our assessment, we have concluded that it probably is an IT. So if you can just sit up here, we can kind of go through what we found.
Okay.
And then I can transfer you over to your next therapist.
Sure.
Okay. So Daphne, after today, we have concluded that it is an IT band issue. We have 2 tests to prove, as well as some range of motion that kind of indicates this.
Okay.
I noticed you also have a lot of gastrocnemius bulk on your left side, which is your ailment side.
Okay.
And you also have a bit of hyperlordosis.
Sure.
Okay. So,
what is hyperlordosis?
so hyperlordosis means you're kind of standing like this with a bit of sway back. It just means the alignment of your spine is kind of pushing back a bit, and it's forcing you to push the belly out.
Okay.
Stand kind of like this.
Okay.
That's completely normal with what's going on with your IT band.
Yeah.
It's just being really tight and pulling everything.
Okay.
So I'm going to refer you over to Agnetha. She is going to be working with you for your treatment portion.
Okay. Awesome.
Great. Thank you so much, Daphne.
Hi, Daphne. My name is Agnetha. I'm going to be your therapist for today.
Nice to meet you.
So, I talked to Jade about your assessments. So we concluded that there's something wrong with your IT band. So I'm just going to be working on that because the reason why is because your glutes and your TFL actually are the muscles that are kind of constricting the IT band. That's why you're experiencing some pain while you're running. So
okay.
I'm just going to be
And it just kind of goes down to my knee.
Yeah.
Okay.
All right. So I'm just going to be treating that area. But since I'm also treating your glute, I need special consent.
Sure.
So I'm just going to have you write it out.
Okay. No problem.
But the benefit of it is that you'll be able to do your activity and stuff. Continue with your running with no pain. And also, just, do your everyday life, what you normally do. So I'm just going to have you lie on your belly. I'm just going to be working at your back of your leg first, and then I'm going to switch you in the sideline position and work on the side.
Okay.
So, so I don't see any contraindications from your health history. The only risk of it is that you might experience some pain, but don't worry, that's normal. But if it gets a little bit worse, come back and then I will treat it again. And the consequences is that you won't be able to get the benefits of it. So I'm just letting you know. And within this treatment, you have the power to control it. So just let me know if you want me to apply more pressure or if you want me to reduce it. And within time period, I'm going to be checking on you periodically just to see how comfortable you are and stuff, okay? And if I've noticed something within the treatment, I might have to refer you to a health practitioner,
Okay.
And other than that, do you have any questions?
No.
Do you have your consent to treat?
Sure. Yeah.
Awesome. All right, so I'm going to have you to sign.
This is just the consent.
Awesome. So I would like you to lie down. I would like you to dress down to your comfort level, but just to let you know, skin to skin works best. So, lie down on your belly between these 2 sheets. Place your face on the face cradle.
Okay.
And I'll just go wash my hands and shut the curtain.
Okay.
And I'll just come back, okay?
Okay.
All right, awesome. How do you feel? Good. Okay. Is it okay if I can use your underwear to
Yeah.
tuck the sheets? Okay. Okay, so I'm gonna begin, alright? How's that?
Good.
So I'm gonna apply pressure. Let me know if you feel any pain, okay? How's that?
Good, I don't feel anything.
Okay. Okay, so I'd like you to slide down. Excellent. Excellent. And I would like you to hold this pillow. Okay. So it's okay if you can. It's okay. You can relax your leg. Feeling okay? So I would like you to place your knee on this. So I'm just gonna reduce your adhesion. I'm gonna do a technique called skin rolling. It might feel pain. Just let me know, okay?
Okay.
How's that?
No, it feels good.
Okay. Just gonna stretch. So I want you to just bend your leg for me. Okay, and I'm gonna get some heat. And I'm gonna do it testing. Just let me know if it feels hot.
Okay.
Is that okay?
No, it's okay.
All right. And I'm just gonna leave it on for about a couple of seconds. Comes to pressure. Okay, so that actually concludes with our treatment. Okay, so once I finish this, I want you just to dress up and then we'll talk more on treatment planning.
Okay.
Because I want to create like a plan that can decrease the pain of your leg, okay? Alright, so Daphne, how do you feel?
I feel good. Yeah.
Okay, that's good. So I'm just going to do a reassessment. So
Yeah.
first I'm going to be taking your blood pressure.
Sure.
So I would like you to place your left hand for me. I got 110 over 62. So it actually dropped down, which is good. And now I'm just going to be assessing your range of motion just to see if there's any improvement, okay? Okay, so I would like you to sit on the table for me. So only with your left leg, I would like you to extend, like straighten your left leg for me. How does that feel?
Good.
Good?
It
No pain?
doesn't. Yeah. Well, not as much as usual.
Okay, so I'm going to apply over pressure. How does that feel?
It feels good.
Okay, excellent. And I would like you to lie on your stomach for me. And I want you to bring this part to here. No pain?
No.
Okay, I'm going to apply over pressure.
No, it's just a little. Yeah.
A little? Okay.
Yeah. A little uncomfortable.
Uncomfortable,
Yeah.
but is it like less than
Yeah, it's
before?
less than before.
Okay, awesome. I would like you to sit. So I would like to create a treatment plan with you. So I want to reduce muscle tension at your glute and your TFL, and I want to also reduce the adhesion, especially your IT band, and also increase your range of motion with your flexion and extension, but mostly flexion. So I suggested we should do a 1 hour treatment per week for 6 weeks. We should do a reassessment on the 3rd week and 6th week just to see if there's any improvement. If not, then I have to modify or change the whole treatment. And also I would like to incorporate some home care. So I would like you to do some heat. So apply heat, especially on your IT band. Just only for 10 to 20 minutes, 1 per day is good enough. At the same time, I want you to also, so basically hold, grab a skin, not the muscle, and just push and grab at the same time and just roll.
Okay. And then do that all along my leg there.
Exactly.
Okay.
And also I want you to do some rolling, foam rolling on your glutes just to reduce some tension.
Okay. Okay.
Do you have any questions?
No.
Do you have your consent for this treatment plan?
Yep.
Awesome.
Okay.